Today in Geneva, at the first International Conference on Prevention and Infection Control, we were delighted to present the results of a 3.5-year study that was conducted at 3 hospitals in the United States. And we were delighted to tell the audience that we've been able to show that antimicrobial copper surfaces introduced into the healthcare environment were able to reduce the number of infections in those rooms with a very limited number of copper objects by 40%. So in our study, we asked a very straightforward question. Is there a solution to this problem that can help infection control practitioners go after the source of hospital-acquired infections? And our area of interest was microbes in the environment. These agents or bacteria are actually constantly trying to invade us, and they're the sources of these infections that patients pick up while being hospitalized. So in our trial, we asked the question whether the introduction of metallic copper surfaces into a very limited number of objects in the patient's room would actually lower the number of infections that were seen or acquired while being hospitalized. And today in Geneva, we presented the preliminary results of our trial, which ended 2 weeks ago. And we were delighted to say that we saw an overall 40% difference in the number of infections seen in patients in rooms with a limited number of copper objects than in patients with rooms with no copper objects. So if you were in a room that had these copper objects, your likelihood of acquiring an infection while hospitalized was 40% less. This is phenomenal. Many other studies have tried to lower infection rates. Hand hygiene, of course, is the gold standard of trying to lower infection rates. Other infection control bundles we learned at this meeting are also trying to lower infection rates, but antimicrobial copper surfaces were able to lower the infection rate by 40%. Pretty remarkable.